10 years ago, my mother passed away. I actually, though, had the privilege, as a doctor, but also as a son, to really help care for her during her last few months.
I had very close relationships with my grandparents, and they really molded who I am today. And without a doubt, I knew I wanted to work with older adults.
In addition to kind of giving her the love, that she deserved, I also found myself as a clinician helping her navigate the healthcare system, fill in the gaps. So in many ways, when I reflect on that, I was not only the son, but I was actually the trusted physician in the family to help her make the difficult choices. And I believe that everyone should have that sort of care.
One of the biggest challenges today that I hear from patients and families is that they have multiple providers, multiple folks involved in their care. No one has the big picture. No one understands what the patients want.
Older adults especially have a really hard time with fragmented care because they have a difficult time accessing it. They literally can't get to doctor's appointments. They have a hard time understanding a lot of what's going on. And unfortunately, a lot of times they do not have the kind of support that they need to give them the time to understand what is happening to them.
So at WellBe Senior Medical, complete care means 4 things. First is we are the providers of care. We're not wrapping around an existing care system. Second is we'll see the member wherever they are. Third is we'll provide the entire continuum of care from prevention all the way to end of life. And then fourth is it's compassionate, empathetic care.
They lose their friends, they lose their families, they lose their independence, so they can't take care of themselves the way they used to. And it is truly a specialty in healthcare.
And that's what geriatrics is about. It's about the quality of life. It's about helping people lead a meaningful life. It's not about the quantity of life. But then what's important about it is we're trained in all of the subspecialties. We're trained in cardiology, endocrinology, neurology. And so we can actually supply all of the patient's needs rather than continuing to refer people to different subspecialties.
At WellBe, we've designed our care model and our teams to be able to provide what older adults need and to be able to deliver truly specialized geriatric care. And that means that we're addressing all of the different issues that older adults face. So if it's spiritual, if it's emotional, if it's social, we have a team member in place to help them.
We never let go. We're always going to be with the patient and the family and the caregiver. We build that trust.
There's other people that bring in resources that are very important to coordinate with. For instance, the Department of Aging and having home-based caregivers, if it's getting a daughter certified to do that, or if it's working with an agency and collaborating very closely to have someone come in so that we can meet our patients' goals, which almost always are to remain at home and to be able to live out their life in their home where they're the most comfortable. We at WellBe deliver care that we would want our family members to receive.
We'll be with the patients and their loved ones every step of the way.
The same care that I provided my mother, if everyone had that same compassion and complete care, that would fulfill my life's ambition.